The theme of this session is kill or cure. In what shape will public services be after the government's deficit reduction plan? That's an interesting and timely theme. I'm sure you'll agree that. It seems to me also to be a kind of critically important theme, which has the potential to be a very significant issue come the next election. Matthew, would you like to kick us off?
The question is a provocative one, kill or cure, and I think it asks about two different but obviously overlapping policy areas. So if I just take the two and try to set out what I think is the answer on both. You will not be surprised to know that I think that public sector reform on the one hand and dealing with the deficit on another are both cures to the economic position that we find ourselves, and also to the long-term performance of those public services. They're interlinked, of course, because the productivity of all public services is important for getting value for money. But it's also important, I think, for the broader economy to improve productivity across the economy. And so it actually is important in the growth argument too. So I think that dealing with the deficit, difficult as it is a cure to our economic situation. And I think that that reforming public services is a cure to the long-term performance of those organisations in face of difficult financial pressures. And so I'm unapologetic and unreservedly on the cure side of your answer.
I want to talk about, as you might expect, services for very vulnerable children who are at risk of abuse or neglect, and try and tease out some of the real challenges that are being faced in local authorities currently in the current context. I think it's worth saying that there are very good reasons to think that these services will be in good shape in years to come. We have a government who is clearly very committed to protecting the most vulnerable in our society. But it's also the case, obviously, that the current cuts to services will mean, in my view, that these services cannot continue as before. And that's because we're facing a real perfect storm in this area at the moment. We're seeing rapidly rising numbers of children moving into care at the same time as significant reductions in spending on those services. Funding is being very, very swiftly cut in children's services. NSPCC has been working with CIPFA to understand some of these current changes, and we're going to be publishing some research shortly. But children's services have borne a bigger share of the cuts than some other parts of local authorities, partly because they've been subject to such increased spending over the last 10 years, so they seem to have room to cut. But it is a major gamble, and certainly in those local authorities that are really swiftly cutting this year, it is hard to imagine mistakes not being made.
Well, I wanted to dwell on the title of it as well, Kill or Cure, which I quite like because of the medical implications, because the patient is sick, and the patient's been sick for quite a long time. If you look at so many areas of our public services, we used huge amounts of spending to mask the fact that actually we didn't really know how to solve social problems. And you can see that across the piece. I mean, you look at elderly care, we've talked about children's care, you look at elderly care, there are plenty of county councils who've done the maths, and basically if they don't do something to contain the cost of elderly care, they go bankrupt somewhere around 2020. So we will have to find a way to make that sustainable, and we haven't done it yet. We've found extraordinarily expensive ways of delivering services that often aren't that good. So we do have to change. I'd like to reframe the title now. I think it's not really about kill or cure, because of course it's neither. For me, it's really about retrench or renew. And Lisa's pointed to some of the challenges in children's social care, which is absolutely right. I mean, what councils are doing at the moment is taking very big cuts. We talk about going back 5 years, 10 years, whatever it is. Of course, that implies that demand isn't changing, and demand is rocketing in lots of areas. So even if we went back 5 years, actually you have to then factor in the fact that the huge pressures that councils are facing. So I think the next 2 years are probably really about councils handling this big wad of cuts, I think probably at some point, probably next summer, you start seeing the more interesting stuff coming through. And the more interesting stuff really does have to be about some of the things we've heard about prevention, investing in that, about finding ways to co-produce with citizens. Places like Bradford are starting to do that by moving a lot of their services down to neighbourhoods and constituencies. So the idea there is that you cut the budget, you hand it down to a neighbourhood, and they can decide what to do with it. So they can shovel their own snow and save some money, or they can pay for the council to do it. It gives people more choice, and I think that's going to be a big trend. Cut the budget, push it down, give people more choice about how they cope with the service. And that's how lots of councils respond to the big society.
As the other speakers done, back to the title, kill or cure. Plainly, it's cure. I think we should have seen the state as a diabetic patient, and putting money into it was like feeding it neat sugar. And at some point, that would have killed the system, and we need to do something about it. I think the cuts are not as bad as people have been putting them out to be. Reducing the amount of money we were putting in was necessary, and I think that should be treated as a positive sign, and a chance for local government, particularly the sector that I really care about, to be able to justify to their citizens why they need to be working in a different way, and why their citizens need to have a different expectation of the services that they're going to get from councils, and actually for people to start taking a bit more direct responsibility for some of the things that happen in life. As a country, we've been spending far too much money on services that don't need to be as bloated as they have been. That's not to say that it's not going to be difficult for councils, but there are opportunities out there, and the government needs to be a bit more progressive in what it's doing. The place-based budget agenda that we were trying to lead through from the local government sector is a real serious area where the state can actually reduce the level of spend and actually give citizens greater control over where it's spent, and still keep the democratic mandate there by pushing it through councils. So it's definitely a cure, and we would have killed the whole system at some point, or we certainly would have killed the private sector that has to, at the end of the day, has to pay to keep it on the road. We just couldn't keep taking the same money out, and so for me, we're in the perfect timing, and it's a great time for local government to be doing what it's doing, but we do need more ambition from the government. I think it's probably fair to say be even more progressive about how we're evolving stuff down and through.